The medical community has long held that early detection saves lives. Radiologist Dr. David Dershaw is a strong advocate for mammography screening.
Women who undergo annual screening with mammography have up to 60% less likelihood of dying of breast cancer than those who do not get screened.
But some cancer specialists and patient advocates say too much screening is being done. Dr. Otis Brawley of the American Cancer Institute says the unwritten rule of early detection through regular screening is misguided.
Cancer is a very complicated disease, and giving very simple messages actually does a disservice.
Dr. Larry Norton of Memorial Sloan Kettering Cancer Center disagrees.
When you see a reduction in death rate everywhere in the world where screening is instituted, I don't know how you can say that that's over-exaggerated.
Fran Visco, who heads the U.S. National Breast Cancer Coalition, has a different view.
When we screen the healthy population, we end up finding cancers that do not need to be treated. We end up finding false positives that get treated.
The debate can be confusing to women who have been told to have regular mammograms. The same is true for men who undergo annual blood tests to evaluate the risk for prostate cancer. Dr. Franklin Lowe says while it may be true that some men are overtreated for prostate cancer, screening is still valuable.
You should be screened because if you have cancer, you want to know about it when it's an early stage, and depending upon what type of cancer it is, how aggressive it is, then make a determination of what is the most appropriate treatment for you.
The U.S. government health recommendation says more studies are needed on the effectiveness of screening for prostate cancer, particularly for men under the age of 75. The advisory also says there is no real evidence that screening improves the outcome of men's health. In addition, the government still recommends that women over the age of 40 have regular mammograms and a breast exam by a doctor. Meanwhile, the American Cancer Society says it will continue to recommend screening until there's a better way to detect breast cancer. Carol Pearson, VOA News.